All right, guys, these are the 2 tests you have to make sure you're getting done when you're getting your thyroid hormones testing to heal well, function well, be able to adapt to stressors, and to find an optimal balance with your thyroid meds post-thyroidectomy when you're healing post-thyroidectomy. Now, my name is Dr. Rebecca Warren. I have worked with women all over the world the last 10 years, working with them with sex hormones, thyroid hormones, healing after thyroidectomy. And on top of that, I had a thyroidectomy and RAI almost 20 years ago. And when I was a patient, I had to draw a line in the sand. I had to really understand what was going on with my body, make sure I was getting the right labs, make sure I was advocating for myself so that I could get out of the hole I was in with all these symptoms and struggling with hypothyroidism, even though doctors were telling me that all my labs looked okay. Now, as a functional practitioner, when I'm working with someone healing post-thyroidectomy, I'm not just focused on thyroid meds. We have to look at your body as a whole. Now, I'm a huge advocate for complete labs. If you haven't gotten my free Optimal Thyroid Lab ebook, please go to my website, drrebeccawarren.com, Dr. Rebecca Warren. The link is in the notes. Get that so that you can know what to get and why. But the reason why I'm such a huge proponent of just getting full labs is because, yes, it can be a thyroid med issue, but sometimes there's some other comorbidities, other deficiencies that are going to affect your body's ability to balance. It's going to affect how you feel. And testing iron and ferritin are 2 big ones that will affect how you feel, how you function, how you heal. Now, I want you to understand, I said iron and ferritin because doctors will sometimes just test ferritin. Other times they'll just test iron. You have to understand that you have to test iron and ferritin, and you have to look at optimal functional ranges. Now, why is iron and ferritin so important post-thyroidectomy? Well, the first time I really started on seeing how it could affect the women I was working with is because I would expect these women to feel amazing once they got onto optimal dosages of thyroid meds. When I work together with prescribing doctors, I was expecting them to feel fantastic once they got on optimal thyroid meds. But when they didn't feel fantastic, and we had to dig deeper. Now, when you are low in iron and ferritin, you can get a lot of the same symptoms you would feel if you were hypothyroid, like fatigue and weakness and hair loss, changes in your nail bed. You can feel emotional, anxious, you can have heart palpitations. You can have a lot of those symptoms thinking it's just my thyroid meds, but in actuality, you have this comorbidity, this co-issue that has to be addressed, okay? Now, iron and ferritin is also important for thyroid hormones for a few different reasons. Number 1, thyroid peroxidase, okay? It's an enzyme, it's hemi-dependent, aka it's dependent on your iron levels. That TPO, thyroid peroxidase, I'm not talking about the antibodies, but that peroxidase is important to convert T4 to T3. So it's important to activate your thyroid hormones. It also impacts your ability to utilize iodine, and iodine is vitally important. Ferritin is also associated with, moving T3 to where it needs to go in the cell so that you can use it. When you have issues with iron and ferritin, you can see that reverse T3 starts to rise. And low iron may also affect your body's ability to bind up T3. That's crazy. This deficiency that can be addressed, very effectively, very quickly, can have major impacts on how you heal and function on thyroid meds. Now, what is iron and what is ferritin? Iron, it's what's in your serum. When you go to get an iron panel, you're looking at what's in your serum. Now, ferritin is a protein that you store up iron, like in places like the liver and the bones. And so one thing to understand when you're looking at iron and ferritin is that iron, when you have enough iron in circulation, you're going to have a good amount of ferritin in storage, and that is good. Not only do you need ferritin to be overall healthy, but ferritin is like this backup reservoir that if you should need some iron, you can pull it out of storage. So they work back and forth together. But what's really important to understand is that you can test one, and if you don't test the other, you're missing a complete picture. So for instance, let's say you have ferritin. Let's say you have low ferritin. Well, do you have high iron? Do you have low iron? What's going on there? And when you understand if your iron's high or low, you can understand how to best support it. Is it low just a little bit? Is it low just a lot? Do you need to go the more intensive route of getting your iron levels up? Or can you take more of a nutritional approach to get your iron levels up? I do want to give this disclaimer. You can take too much iron, okay? You can take too much of it and it can be toxic. And you do not want to start utilizing iron without getting blood work done. So get that blood work done, look at the iron, look at that ferritin. Another scenario that can happen is you have low iron. So your doctor just looks at your iron panel and you have low serum iron. Well, if you go and you get on, iron supplementation and you're trying to get these levels up and you're not testing ferritin, what if your iron's low and your ferritin's really, really high? What does that mean? Well, ferritin is what's considered like a reactant. When you have underlying infection, when you have a lot of inflammation, your body's going to try to protect itself. It's going to take iron out of circulation. It's going to put it in storage. So if you're not looking at ferritin and you start putting all this iron in your body, having too much ferritin is dangerous. It is a problem you don't want. So those are just two kind of scenarios, like iron can go high, iron can go low, ferritin can go high, ferritin can go low. You want to see the patterns that are there. I'll give you one more scenario that I found is that sometimes people will look at iron and iron looks good or it's on the high end of the range, okay? And you think, oh, my iron's fine, but if you look at ferritin, ferritin's really low. Well, why would ferritin be really, really low and iron is good or high end of the range? It's because you're actually anemic. You actually have low iron and it's severe enough that you're pulling so much out of storage that now your ferritin's going down. Again, so important to look at the body as a whole. Now, why would you be iron deficient? What do I tend to see as the biggest things? There's different reasons. It can be like heavy menstrual period. You can have gut issues. There could be bleeding within your digestive tract. But I will say between heavy menstrual flow, okay, because thyroid hormones being suboptimal will affect your menstrual cycle. But two of the biggest things I see is women that are not eating enough protein, or the fact that you are within range, medical range, with your active thyroid hormone, but you're on the low end. So you have slowed down your digestive tract. You have affected your body's ability to break down the foods that you're consuming to get the nutrients out of it and to absorb it appropriately. And the thing that sucks with that, the protein thing, we can, address, we can hit that right. But the thing that sucks with the T3 situation is that you need adequate iron and ferritin to get balance, but you're also imbalanced, which affects your ability to get iron and ferritin in. That's very important to understand, that you have to hit it. If you are low enough, if you have low iron, low ferritin, if you're showing those signs, that you get it up to levels that are appropriate for you, and then see how that affects your thyroid hormones, and then you can modify those thyroid hormones with your prescribing doctor accordingly, okay? So it's really important. Now, like I said, you can't take too much iron. You want to make sure, the way I test, to make sure that we can figure out levels that are correct with the women I work with, is we test 4 weeks into utilizing iron and then 90 days. You want to make sure that you're taking enough for you. Now, some of my favorite iron supplements, depending on where you're at, can be things like Floradex. I do yeast free. I'll put a link in the bio of which one I love. I love utilizing iron bisglycinate. I see that women do really well with that in regards to absorbing and not feeling upset in the gut. I also utilize magnesium and vitamin C, which I will link my favorite forms that I have seen great results on labs in the notes so that you can have those. But before you go off and start supplementing, remember I said you can take too much iron. Look at your lifestyle, look at your nutrition and start there. Are you consuming enough protein? Most women are under eating protein. You want to eat enough protein throughout the day. Increase the things that will help with the absorption and utilization of iron, like vitamin C, using not emergency, not those crappy types. You want to use good quality, high dose, bioavailable vitamin C to help get iron into your body. Utilize things like cast iron. I talk extensively with my Thyroid Inner Circle community about toxins that we can be exposed to that can really wreck our hormones. So we stay away from Teflon non-stick pans, utilizing full stainless steel, but utilize cast iron. You can support your iron levels in that way, but making sure that you're aware that there will be other things that can affect your balance. You don't want to just focus on that. You want to focus on the body as a whole. And the last note I will leave on, one of the most common kind of questions and things I get after I do something like this is, but my doctor won't order that, or my doctor says it's not necessary. Either you fire your doctor and you find someone else, or you can order any labs that you need yourself. And I'll put a link to Ulta Labs here in my notes. You can see my link where I show my optimal panel, or if you're missing one or two, like let's say your doctor tests ferritin, you can go ahead and order yourself iron if that's what you're missing, or vice versa. But please remember, suffering post-thyroidectomy is not normal. Gaining weight post-thyroidectomy, getting depressed and anxious, having heart palpitations, that's not normal. Like, post-thyroidectomy is not an easy journey, but you don't have to suffer. And what I find is that people suffer unnecessarily because they're getting misinformation, or they're not getting the right amount of information to help support them. So if this has been helpful for you, please like this video, subscribe to my YouTube channel, leave any questions that you might have about iron, ferritin, and thyroid hormones in the comments section. I will be interacting and answering those for you guys, and I'll see you next time.